Hi, welcome to Candid Chats on Cancer. I'm Mary Robinson.
And I'm Jamie Moore. So Mary, what are we talking about today?
Well, we are going to talk to Matt Prokop, who is the Nebraska Grassroots Manager at ACSCAN. Can you tell us what that stands for?
Yeah, so first of all, thank you again for having me on the show this evening. So ACSCAN is the American Cancer Society Cancer Action Network. It's our advocacy arm of the American Cancer Society that works on public policies on the state and federal levels that help cancer patients. And what I do in my role is I work with the volunteers, give them the tools and resources to contact their state senator or their federal lawmaker on our priority issues that we work on. And so I worked with volunteers all across the state of Nebraska on our various priorities that we worked on.
Wow.
So what would be some of the initiatives that we should be getting into as cancer?
Yeah, so on the federal level, not a lot of people know this, but the federal government's the largest provider of cancer research funding. ACS, the American Cancer Society, is the largest private funder, but the federal government is the largest funder of research dollars. So we always want to make sure that we're advocating for either an increase in funding or stable funding moving forward. And we've been very fortunate with our work with ACSCAN, where over the last 4 years, we've seen an increase in cancer research funding. And where those funds come from is the National Institutes of Health. And then under the National Institutes of Health, there's a National Cancer Institute. And so we want to make sure that that funding's increased. And we had an initiative called the 1 Degree campaign. The premise of the campaign was that everyone is 1 degree from cancer, whether it be themselves, a family member, or a friend, and utilizing those stories when we talk with our federal lawmakers on the importance of cancer research. And so using that initiative, the goal of the initiative was to increase cancer research funding by $1 billion.
Good.
And we were able to achieve that. It took us a little bit longer than we had hoped. We wanted to do it in 2 years. It was 3 years that it ended up happening. But we were able to get increased funding through Congress, which isn't easy considering, different budget shortfalls and concerns on spending. And cancer research funding truly is an issue where you get bipartisan support. You get Republicans, Democrats, independents that are supportive of research funding. So that was kind of one example of a federal issue that we worked on with great success that we've had with ACSCAN over the last few years.
Now, how does it go from point A to being finished to actually having the money to go into the research?
Yeah, a lot of it is just individuals meeting with their lawmakers, telling their stories about the importance of cancer research. And we provide that opportunity, whether it be email alerts. We do email alerts within our network where people can share their story through those, or they're pre-written. If they just want to put their name and address and not include their story, they can do that, and then that goes to their respective lawmaker. Because if lawmakers aren't hearing from a lot of constituents on this issue, they'll think it's not a priority. And so we provide the tools and resources to do that. Email alerts, phone calls. We encourage people to make phone calls to their lawmakers throughout various times of the year. Every year I go with a team of volunteers to Washington, D.C. for a federal lobby day. And we have 3 congressional districts in the state of Nebraska, and then a state lead ambassador. And so we're a small but mighty team in Nebraska. We have 4 volunteers that go and myself, and meet with our congressional members every September. And usually that's a prime time for us to be meeting with them because they're making budget decisions.
Right.
So a lot of that is just the open dialogue with lawmakers, hearing from their constituents because they work for their constituents. They want to hear what they have to say about important issues. And so we provide the tools and resources for volunteers to do that.
That's wonderful. So be a squeaky wheel.
Be a squeaky wheel does get fixed.
Yeah.
Yep.
That's
so
great.
Now you're making a letter available. So it was like, for me, I'm not very good at email communication. Mm-hmm. So, but if I wanted to, I could go to your website that has a pre-written letter.
It does, yep.
That all I have to do is just give you permission now to send that off to, let's say, my congressman here in Nebraska.
Yeah, so if you go to fightcancer.org, there's an action center on there, and it has all of our action alerts for every issue that we work on. And all people really, and it really only takes 2 minutes truly, all you have to put is your name and address and hit send, and then based on that address that you put, it'll go to your respective congressman or senator. Senator, obviously, it's statewide, so your address doesn't matter there, as long as it's from Nebraska. But for Congress, we need that address just so we know which congressman to send it to.
So it sounds like it's already set up.
Yep, it's already set up. Yep, in the Action Center, and all people have to do is, they can certainly share their personal story. We allow them the opportunity to do that, or they can just utilize the text that we have in there, in that pre-written action alert. And then their office gets that, and a lot of times what happens is the staff from that office, congressional office or center, they send a response letter back saying, thank you for your email. We'll take your comments in consideration as we make those decisions on voting and budget purposes. So, 2-minute thing, but it's very important for people to hear, for lawmakers to hear from their constituents. And so we provide the tools and resources to do that, because you really, with lawmakers, they get pulled so many different directions on so many issues. They need to hear on a regular basis from survivors, caregivers, people that work in the healthcare field, because they're the ones that have those personal stories.
It's so nice too that you're making it easy for people, because sometimes, like us as survivors, we're tired, we're trying to fight the fight, and if we could just go online and type in our name or whatever, and we don't really need to tell our story unless we want to, that makes it really simple.
Yep.
Yeah, thank you.
Yeah, and in terms of other federal issues that we work on, access to health care is a very important issue, making sure that there's patient protections in place, like pre-existing conditions, someone not getting kicked off of their health insurance plan because of a condition like cancer, no lifetime caps, because obviously cancer care is very expensive. So making sure those patient protections are in place for patients for health care coverage.
So what do you mean by caps on your insurance?
In terms of like the spending amount
Okay.
for coverage, because there used to be, before the days of the Affordable Care Act, there used to be a cap on how much money could be spent on your coverage.
Really?
Yeah, like some insurances, they cap you out at $1 million, and then you're stuck with the rest.
So as if you're really sick, because going through $1 million for a cancer person doesn't take that much time.
Pretty easy to do that, yeah.
I told my husband I'm the $1 million woman, and I'm worth every penny. That's what I said.
Yep. Yeah, so
Plus or minus.
Plus or minus a couple of pennies.
Yeah.
So,
It's according to the week and the depreciation of your value, or appreciation of your value.
yeah, because we've seen, when people don't have health coverage, a lot of times with those individuals, they get diagnosed at later stages.
Right.
Thus, they have a less chance of survival. And so by having healthcare coverage, you can gain access to preventative measures, screenings that can save your life. And we're always fighting to make sure those patient protections are maintained and improved on moving forward. We always talk about the 4 A's of healthcare: affordability, access, administratively simple, and adequate coverage, so that you're getting coverage. Because sometimes too, with healthcare coverage, you can be on a plan and not know that you don't have those patient protections. You might see a plan that's cheaper, but it doesn't provide the comprehensive coverage that you need as a cancer patient. So we want to make sure that we're educating folks on the type of healthcare plans out there, that there's navigators out there that can educate the general public on these are the plans available for you to choose and make the best informed decision for your healthcare needs.
That's so important too. I remember when I was first diagnosed, my husband and I went through his insurance and my insurance pros and cons,
Right.
and we determined which one was best for me at the time. And the funny thing is our other insurance was better, which was his insurance, because it did not have a cap. And I think
Right.
that it's very important for people to research that, because you just think you might have the greatest insurance ever, but you might not read all the fine print because everything's happening so fast.
Yep.
So really, another A could be you're advocating for people too.
Definitely, yep.
Yeah, and I just think that's such a great resource that we have
It
here.
really is. What kind of brings me to some point was you were talking about people who may not have insurance that get cancer. I mean, cancer is, as Mary and I know, it's very indiscriminatory. You get cancer no matter who or what your economic status is. Fortunately for both of us, we have insurance. What about the person who doesn't have insurance? that's what you're fighting for. That's your advocacy, are for those people.
Yeah, unfortunately, right now there are a lot of Nebraskans that are falling in they call it the coverage gap. Basically, what that means is they make too much money for Medicaid to qualify for Medicaid, but they can't qualify for tax subsidies to afford coverage on the health insurance market. So basically, they're falling in this healthcare coverage gap where they can't gain access to healthcare. Nebraska recently voted on a ballot initiative to expand the Medicaid program. Basically, what that means is it would allow more people to qualify for the Medicaid program. It would change the requirements in terms of income that would be needed to qualify for Medicaid expansion. And it's projected that 90,000 Nebraskans would gain access to healthcare coverage through Medicaid expansion. And we're already paying for that federal funds by expanding Medicaid. Other states have decided to make that decision to expand their Medicaid program. Nebraska made that decision through a ballot initiative. But there's federal funds that are used to pay for it, and then the state will end up paying for 10% of the cost of Medicaid expansion. So right now the states, now that the Medicaid expansion has passed, the state will have to decide on how they want to implement the program, as well as pay for the program, and they'll be making those decisions here soon. The legislature convenes on Wednesday of this January 9th, and so that will be one issue that they're looking at in terms of talking about ways that we can pay for Medicaid expansion and how we're going to implement that program kind of moving forward.
So right now is a good time for us to get all on the website, get hold of our legislators. And
yeah,
since
it's
we're not
always
getting into
any
it.
time, whether they're in session or not in session, we always recommend people reach out to their lawmakers on issues like that. So.
And several times or just once?
Oh yeah, several times.
Any-
And a lot of times with advocacy, you have to be really persistent. It takes several years to get a bill passed. And so a lot of times you need that constant drumbeat of communication and letting them know that the issue is still here and that's important for us to get it passed. Just because the legislative process, you have to go through several steps to get it passed, whether that be on the federal level or state level. And so sometimes on an issue, it can take several years for it to get passed, but you really need that persistence and continued willingness to share your story with lawmakers.
In other words, if you don't get the ball rolling, nothing happens.
Right, yep.
Yeah.
So, and then I'll just mention a couple other federal priority issues as
please.
well that we worked on. One is palliative care.
Okay.
Palliative care is an extra layer of support for the cancer patient or anyone of any chronic illness, basically helping with better quality of life for the cancer patient in terms of better management of pain, better outline of their treatment options. And so there's legislation in Congress, and we were fortunate enough to get it passed in the House of Representatives, but we ran out of time because a new Congress was just seated last week, and so the bill will have to be reintroduced.
Okay.
So basically what the bill does is it provides education, training, and research on palliative care. A lot of times people don't realize that palliative care is available for during any stage of your treatment. A lot of people think, it's just end-of-life care,
Right.
and that's not necessarily true. That you can access palliative care during any stage of your treatment.
Can you give us your definition of palliative care? Because that's what I thought palliative care was, your last week.
Right. So palliative care is really basically bettering quality of life for the cancer patient. So better managing their pain, better understanding of treatment options. Because as a cancer patient, you just get bombarded with so much information, and sometimes you just need some clarity on the options that are available. So the palliative care team comes in and kind of helps you and helps the caregiver and their family better understand treatment options that are available. That's kind of what palliative care is all about in terms of helping those patients in terms of managing their pain. There's also a clergy portion of it, and every team is different in the state. Nebraska, it's in 80% of our hospitals. How it's different is the different hospital systems, their team may be made up of a social worker, a palliative care doctor, a nurse, and some palliative care teams also might have a clergy as part of their team as well. That can help with any of those type of needs as well. And it's kind of a really growing discipline. Like I said, it's in 80% of our hospitals. it's just a matter of getting that education out there so people know that's available during any stage of their treatment, and also doing the research to show how we're better utilizing palliative care to save healthcare costs, a better quality of life. We've done some studies that have shown that when you've done palliative care, there's less visits to ICU, less readmissions to the hospital. It's just a matter of kind of doing additional research on that, and then also training our healthcare professionals so that they're utilizing palliative care at the appropriate time and helping the patient as well.
Mm-hmm.
And then,
so it's not like hospice?
No, nope.
Okay.
It's palliative care is, hospice, palliative care is basically a longer term type of care, where hospice is that short term care like you mentioned. Mm-hmm. But palliative care can be utilized
for like 10, 20, however many years?
Even after you've gone through treatment, and you're, because obviously as patients, you know, as you go through your treatment, you're going to have continued pain even after you're done with treatments that palliative care can help with.
Mm-hmm.
Now, when we talk about palliative care, what other services are available for us in the community for your cancer survivors and people going through cancer right now?
Sure. So some different services that the American Cancer Society provides. We have the National Cancer Information Center. That's a number you can call 24 hours a day, 7 days a week. You can even call them on Christmas, holidays, if you have questions on nutrition, healthcare coverage, clinical trials, additional programs and services in the area. Representatives can help you with anything that you may need in terms of questions that you have on those areas. We also have a program called Road to Recovery, where patients can come and, you know, a big barrier for cancer patients is transportation, getting to and from their treatments. And so what the American Cancer Society does in various communities across the state is they provide a volunteer driver that's trained to pick up the patient and transports them to and from their treatments free of charge.
Really?
Yes.
And how do you, like, do you have to qualify for that kind of service? Do they ask questions about income or whether or not you have a car or anything like that?
Disability or?
No qualifications like that. It's just a matter of, is there a driver in the area that can come pick you up? A lot of it's coordination through our patient service center, so that they know that the request's out there and see if there's a driver available. I work out of Lincoln, and this is kind of an example of kind of a driver that's in Lincoln that'll go to other communities. But we have drivers that, you know, are from Lincoln, and they'll pick up, you know, patients in York if needed.
Wow.
Kind of one example like that. Kind of depends on the driver and their availability. But there are drivers I know in Lincoln that are from Lincoln that go to other communities to pick up patients, because a lot of patients come to Lincoln too for their care.
Right.
That can transport them to and from their treatments. So
you don't necessarily have transportation throughout the whole state of Nebraska?
Not necessarily, or we'll work with other programs. I know there's like a Yellow, Wear Yellow Nebraska, I believe it's the name of the organization, where if we can't provide that service, we may have partner with another organization that can provide that service. And our National Cancer Information Center, they have that all at their fingertips in terms of seeing if there's that type of service available in their community.
Okay, so let's say I needed a ride. I go to the info center and type in the dates. In other words, don't call, you know, if I have a, you know, let's say I have a meeting on Friday with my oncologist for chemo, don't call you on Thursday, basically, right?
So,
give you at least a pad?
Yeah, so what I would recommend is calling the 1-800 number. It's 1-800-227-2345, and, you know, identifying yourself and saying, you know, I'm calling to see if there is anyone available that can provide me transportation through the Road to Recovery program. And they'll work with you on that in terms of scheduling that and seeing if there's drivers available. Or you can go to cancer.org. That's that's the American Cancer Society's website. And you can go on there and get additional information on Road to Recovery as well.
How great is that?
Yeah, it's a great service that we provide that a lot of folks don't realize that is available throughout different communities across the state.
Yeah, because I know it caused me some, you know, anxiety when I didn't know whether or not I could get a ride. Like my wife had something that she couldn't get out of. So even for me, that would have been a wonderful idea. How can you volunteer to be one of these drivers?
Yeah, so with those drivers, they go through a training program. they can go to cancer.org and they sign up to be a volunteer. Basically on cancer.org, it'll give various different programs. It'll give advocacy also as a way to volunteer, and then they check that box on the website, and then a representative, whether it be local or national, gets in touch with them about their availability and interest in volunteering, and then kind of coordinating that with the local staff that works in those areas on how they can be a volunteer and what different hours, and if there is training involved, what necessarily that includes for that program.
Do you do a background check or anything
They
like
do,
that?
yeah. For Rotary Recovery, they do a background check.
So you're vetted.
Yep.
So everything.
Yep.
Wow.
Yep.
Yeah, that's great.
Yep.
What other volunteer opportunities are there?
So in terms of advocacy or other programs?
Anything you want to tell us.
Okay, so I'll talk a little bit about the advocacy side,
Okay.
Yeah.
because that's my expertise
Perfect.
with the organization. So in terms of the advocacy side, basically how we're structured is we have a state lead ambassador, we have lead ambassadors in every congressional district, so 3 congressional districts, and then under them they have volunteers that help with Letters C editor, help with fundraising, help with additional volunteer recruitment, help recruit ACSCAN members. ACSCAN is a membership organization. It's $10 to become a member. And so those volunteers help recruit additional volunteers and grow our grassroots network. Also help gather stories so that, say we need a story on access to healthcare issues, we can find that story and utilize that through various aspects of our campaign, because we utilize stories through testimony at hearings, through email campaigns, through face-to-face visits with lawmakers, things like that in terms of activities where their story can be utilized. And then also we have ambassadors. Nebraska has 49 legislative districts, and so we try to get a legislative ambassador in every legislative district, so that if we need to reach out to a certain senator, say they're chair of the committee on an issue where we really need to get their support, we can reach out to that volunteer in that community and say, as a constituent, can you reach out to your senator on, access to healthcare issues or tobacco prevention, things like that, because they love hearing from their constituents.
Right.
And that's really what motivates them to support an issue. Those stories are really powerful in getting laws implemented and passed, and we coordinate that so that their story can be involved for some part of the campaign, and we keep it flexible for what people feel comfortable doing. Some people feel comfortable, more behind the scenes, writing Letters C editor or doing email alerts or making phone calls. Some volunteers are more comfortable doing public testimony, meeting with their lawmaker face to face, and we're flexible on that and give people the opportunity to do a variety of different activities to whatever they feel comfortable in terms of sharing their story.
So if Mary and I, for instance, wanted to go see our congressman, probably neither one of us would have a clue. Well, I'll speak for myself. I don't have a clue on how to
I don't either.
see a congressman or even walk through the door or even make a meeting to say, we have a show on cancer that shows that palliative care is wonderful and all these other things. How do you do that?
Yeah, so a lot of it is just working with me. That's what I do in my role, is work with the volunteers. A lot of it would be just kind of coordination through their office in terms of scheduling a time to meet, and then working with you, getting the training. We do a hook, line, and sinker training. So if you have an interest in meeting with your lawmaker face-to-face so that you feel comfortable, what we do is a training called Hook, Line, and Sinker. And basically that allows you to get your story in the appropriate amount of time, because with a lot of those meetings, they're pretty straight to the point, and you only get so much limited time. So you want to make sure that you're very disciplined and straight to the point in terms of your message. So the hook, in terms of generally identifying yourself as a constituent, where you're from. The line is your story, telling your cancer story relative to that issue that you're advocating for. And then the sinker is a general ask. So a lot of times we ask, will you co-sponsor this bill, or will you support this piece of legislation? So a lot of it's just that general practice of working with myself and our volunteers. And a lot of times, what people don't realize with advocacy is you don't have to be a policy expert on the issue. It's just your willingness to tell your own story, because those stories are powerful and do make a difference. They hear so much from myself, and we have a director, Nick Faustman, and we have also a lobby firm on the state level, and then on the federal level, obviously, we have lobbyists as well, but they hear so much from our staff. What really motivates them to support issues is hearing from our volunteers and their constituents.
So like, if we had something like marijuana, pushing that for people for cancer, medical marijuana. So you would help us if we came in and said, okay, this is what I'd like to see pushed through because maybe this will help another person. You would help us develop the whole thing, bringing us into a nice short little time period, and then we get in, get out.
So yeah, on that type of issue, on medical marijuana, we don't take a position. We don't support or oppose that. A lot of it's because we're science-based in terms of any position that we take. There has to be scientific evidence showing that, and it has to be comprehensive, showing that it's going to help the cancer patients moving forward. And so on that particular issue right now, there's just, and part of it's just because the way it's classified as a drug, it makes it harder to do research on, where that makes it a little bit trickier in terms of that position, because there isn't a lot of scientific data from a variety of different resources on that particular issue.
Cool. So we got about 30 seconds left.
Yeah.
Okay.
Time just flew.
That did fly, yeah. Yep.
Is there anything you can just, in a nutshell, tell Mary and I, what can we do to be a bigger advocate?
Yeah, so and people watching the program, they can go to fightcancer.org. There's a volunteer tab on there. You can go in and sign up to be a volunteer, and then I kind of, once you sign up, have a conversation with you in terms of what issues that you're interested in, and then also we have a state page on there, fightcancer.org/NE, and that has our state page as well. I didn't get an opportunity to talk, we ran out of time, but about state issues that we worked on, like tobacco prevention, access to care.
Yeah.
You know,
you'll have to come back.
I'm just sitting there going, that just gives us a good reason to say,
Yep. So if you go on that state page too, it shows all the state legislation that we'll be working on. I mentioned earlier, the session's going to be starting on January 9th, so we're definitely going to be in need of more voices to get some significant issues passed, like tobacco prevention, prohibiting teens that are under 18 from using tanning devices, because that's a cause of skin cancer in terms of younger citizens using tanning devices.
Yeah, we definitely need to have you back, man.
Yep.
Yeah,
without
definitely.
a doubt.
Yep. So I appreciate you giving me the time tonight. And
Yes,
and
thanks
thank
so
you
much
so
for
much.
joining us.
Yep.
Really.
Yep.
And join us again for Candid Chats on Cancer.
Come in advocacy for cancer. Call Matt. Have be well.